Okay, so welcome to my presentation on my practicum placement. My name is Wong, and I'm wondering, have a question for you guys actually. Are you ready for another PowerPoint presentation? Yeah, okay. All right. Okay, so I'm going to try and make this very interesting for you. I got the mic in one hand and I got the laser pointer in the other because, I was thinking about what am I going to do with my hands up here. So
Fill them up.
Fill them up. There you go. So I'm going to do this presentation with a little bit of a twist, and excuse my pacing. I'm a pacer. If I try to stand behind a podium, I'll just be vibrating. So I'm going to try and just wrap out my whole entire presentation. Okay? No, I'm just kidding. Don't freak out. Okay, so I'm actually going to talk to you about just a quick overview of what I did at Ongomiizwin research. The reason why it's an overview is because I only have 5 minutes. Okay, so I'm going to start with something very important. I'm going to start with the Territorial Acknowledgement, and I think we have heard a few from Victoria today. I just want to talk about the one from Winnipeg. So I'm from Winnipeg, and Ongomiizwin is located in Winnipeg, Manitoba. So the University of Manitoba campuses are located on the original lands of the Anishinaabe, Cree, Oji-Cree, Dakota, and Dene peoples. And it is the homeland of the Métis Nation. So the research I'm doing here today, it's actually in relations to Inuit peoples from the Kivalliq region. So I also want to give that acknowledgement to the participants. Okay, what is Ongomiizwin research and what is it currently working on? So Ongomiizwin research is actually the Indigenous Institute for Health and Healing, part of the University of Manitoba. It is actually one of the biggest Indigenous education and health units in Canada. The reason why is because it consists of 3 components. It has Ongomiizwin research, Ongomiizwin education, and Ongomiizwin health. And those 3 components make up the institution. And by now, you guys are probably wondering what the word Ongomiizwin means. It is an Anishinaabe word for clearing the path for generations to come. So right off the hop, you kind of get an idea of what the mandate of the organization is. They really take a life course approach and really try to encompass the Indigenous perspective in research, education, and also health. Okay, so this is a picture of me on my first day at the office. I was wondering what the heck am I going to do? I really wanted to do something in research because it's something that I haven't done before. But I showed up in the office and I'm like, what am I doing here? Okay, so luckily, my practicum supervisor gave me a very neat package of what I'm there to do. So first of all, I want to talk about the project that's going on at the research center. It is an action research project in response to some of the health issues that are experienced by people who had relocated to Winnipeg from the Kivalliq region for medical purposes. A lot of people get lost in the urban center due to several barriers, and we're really trying to look at what we can do for these people. So actually I really like the quote our keynote speaker Marisha said about finding the path and knowing where you're going. So action research goes a little bit further than that. Not only does it give you a destination, finds out draws out the path of how to get there, they actually walk that path, so we can figure out what the small details are. My job there is to complete an asset map. It sounded like something that's fairly easy because we did an assignment in the course, but when you actually sit down and start doing it, it is so much more comprehensive than I originally thought. I did some literature search and found that there were a lot of need for resources in 10 different categories. I'm not going to get into details because I don't have enough time. I already got the warning. So I'm just going to let you know that similar to one of the master's colleague had said here about asset mapping, it really is a strength-based perspective on what the community has to offer and allow the community to participate in the research. Okay, looks like my time is up. So I am going to skip directly to here. So a big thank you to my Practicum supervisor, Dr. Jose Lavoie, and also Leah McDonald for putting my Practicum together, Natalie and Betty for helping me get through this whole entire process. If you guys are interested in learning more about the project, please come to this Facebook group here. You can learn more about it, and you can also invite Dr. Lavoie as the next keynote speaker at the next conference. Okay, that is it. Thank you very much.
Thank you. That was a great presentation.
Or half of it.
I'm going to pay it forward for what Isha did for me and ask you if you'd like
awesome.
to share any of the things you didn't get to say.
All right, thank you, Madison. I actually just wanted to end it there, but okay. I just want to say that the biggest thing, two points. The biggest thing that I wanted to do in this community asset map is to actually do a bit of a participatory mapping exercises, but because of the constraints of the BA practicum, we cannot have any interactions with participants, so I was not able to do that. That's one of the biggest regrets I had in this practicum. Secondly, I just want to mention a little bit about cultural safety in research. That was one of the values that I had up on my slide. During my practicum, I came across some very important information. Most participants mentioned that the feeling of being misunderstood, mistreated, or marginalized are the biggest communication barriers. And those stem from cultural issues such as racism, language barriers, and just attitude and behaviors of some of the healthcare providers that is making people feel unsafe. So that's probably one of the most important messages that I have that came out of my literature search. And that's pretty much it that I want to say. Should I toss the mic over there?
It's being webcast, so.
Thank you. I'm curious with the asset mapping, what some of the assets were, if this is your strengths-based approach, if these were all physical assets, or if knowledge and language were also assets, or some of the in the holistic picture, what some of those may have been in the community.
Okay, thank you very much for asking a question. How much time do we have again? What the asset map that I did was on Google My Map. That was the only free platform that I can find that can be easily manipulated. So everything on my map is fairly physical, or at least it has a physical location. It goes way beyond that, though, for an asset map. If we're able to do a community participatory asset mapping exercise, we'd be able to write it on a piece of paper. And like you said, we can have resources such as language. That was one of the biggest requests from community, is to have those cultural brokers or at least an interpreter to help people navigate the system and to understand what the healthcare providers are saying. Basically translating those Western biomedical terms into something that people can understand and can relate to. So those are definitely assets, and those are definitely what's missing in my map, because I was not able to communicate with any participants. So I did the whole thing based on literature search. And all the assets are grouped in the most important social determinants for Inuit people. Thanks. All right, well. looks like that's not
Hi,
it.
Ka. Sorry. It was a great presentation. One of the things that I remembered, I think you and I worked on this project, but maternal health was a big thing that was accessed quite a bit because of so much isolation that a lot of people were being displaced from their homes when it was time to give birth, and not all of the time their spouses were allowed to come with them. So I was just curious if any of that asset mapping included any sort of components to help assist women that were alone or socially isolated from their communities in your asset map.
Yeah, absolutely. Thank you for that question. Maternal health and actually the health of the children is one of the categories. It is so important because there are lots of stories coming from the community in regards to coming to Winnipeg from the Kivalliq region to give birth, and some of the experiences that they had. And that ranges from sexual exploitation to anywhere from being inappropriately placed in housing situations where it's not good for people who are immunocompromised. Living in communities, obviously, that are unsafe and not good for children growing up. So those are, we have a lot of resources for that, and there's some very complex dynamics in that maternal health because there are also domestic situations that we need to take into consideration when we ask people, would you want to stay in Winnipeg or would you want to go back home? And housing situations because of the crowding in the Kivalliq region, and it's just a lot of things. But we do have some resources that we found in Winnipeg that are designed for use by women. Yeah.
Okay, I think we're going to have to leave it there, but thank
All
you.
right, perfect. Thanks, Natalie.